Fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
The economic impact of COVID-19 on women in micro, small and medium enterprises, which accounts for 40% of the global revenue, is devastating.
Kabla corona iingie, kazi tulikuwa tunapata wamama. Unafanya kazi, tajiri anakusaidia hata 1,000, 2,000 ama 15, wengine 500. Lakini tangu corona ikuje, kazi ikapotea. Tukaambiwa na watosi mtatuletea corona. Tumehangaika sana. Tunakaa kwa barabara kutoka asubuhi mpaka usiku. Hakuna kazi mtu anakuchukua. Hakuna unga tunapata. Nyumba za wenyewe agent wanakuja wanafunga. Kama mimi, tangu corona ianze huko Kabangwale, sijawahi enda kazi. Watoto wanalia, wanaingia kwa manyumba ya watu. Ukirudi jioni unatoka kutafuta kazi, unaambiwa mtoto alikula chakula niliwekea watoto yangu. Huyo mama anaanza kelele na mimi nashindwa nitafanyaje.
In Kenya, immediately after the confirmation of the first case of the coronavirus in March 2020, the government took a number of measures to curb the spread of the disease. These included the implementation of a dusk to dawn curfew, restriction of movement, closure of markets to enforce social distancing measures, use of personal protective equipment or PPE, observing proper hygiene, and the suspension of international flights, among other protocols. And in Majengo slums, commercial sex workers have not been spared either by this pandemic. As a way of maintaining social distancing measures, the government closed all social joints or bars. This has left many commercial sex workers like Rita Wanjiru, not her real name, and her colleagues struggling to make ends meet as their clients have disappeared for fear of contracting the virus.
Wateja hawakuji, bado tunawaokopa, wanatuokopa. Hali ikiendelea hivi itatudhuru sana. Na sisi tunaumia kwa sababu tuko na watoto wako primary, wako wengine wako secondary na sina hela.
It is for this reason that the Association of Media Women in Kenya, AMWIK, together with her partners, launched a survey in April 2020 to document the impact of the pandemic on women in micro, small and medium enterprises and make policy recommendations to different actors on the way forward.
In March, when we had the situation of the COVID-19 and looking at the protocols and the recommendations that emerged, that people should work from home, that there should be social distancing, and everything that came about with the COVID-19, we reflected and as partners came together to do an urgent response with regard to women's economic empowerment. We have been documenting these experiences, gathering evidence, and we've now gathered quite some bit of evidence. And therefore we are saying that going forward, we want to present this evidence and this information and deliberate and make policy recommendations or recommendations to different actors that on the way forward in terms of rebuilding the businesses as well as building resilience for these businesses in case of a future shock that emerges that affects their business.
COVID gives us an opportunity now to strengthen, to re-strategize, to re-engage the stakeholders, and the stakeholders here at government, because you see governments are responsible for making policies. They are responsible for coming up with laws. What we want to see is that women voices are included in these policies, because it's only through policies then that we can able to change or address the challenges that women are facing.